If you have rheumatoid arthritis, there are foods that you're eating right now, foods that seem completely normal, maybe even healthy, that are quietly making your inflammation worse every single day. I'm going to walk you through 7 of them. I'm going to tell you why each of these is a problem. And the one towards the end is the one that people often never suspect. I'm Dr. Neha, a rheumatologist, and food genuinely matters. This is not wellness advice. I am not a wellness influencer. But I have seen real improvements in patients who have changed their diet, less pain, fewer flares, more energy, which of course we all want, and RA can really take away from you. And for most people, medication is not optional. It's what protects your joints from the permanent damage, while you're also doing everything right. So think about what I'm about to tell you as something that works alongside your treatment, not instead of it. The goal is to stop unknowingly adding fuel to a fire that your medication is already working very hard to put out. All right, let's get into it. 7 foods, starting with the one that has the most evidence behind it: sugar and refined carbs. Number 1 on our list is sugar, specifically added sugar and refined carbs like white bread, white rice, and sugary drinks. Here is a striking study, 20-year study of over 100,000 women found that drinking just 1 sugary soda a day or more increased the risk of developing rheumatoid arthritis by over 60%. And the reason this happens is when you eat sugar, your blood sugar spikes. Your body responds by releasing insulin. But when you repeatedly do this, like it's okay once in a while, but when you repeatedly do this, your blood sugar also turns on your inflammatory switch. It raises levels of those exact same chemical messengers that your medication is trying to block. There's another process called glycation. Sugar molecules essentially stick to these little proteins in your body and damage them, producing something called AGE, advanced glycation end products, or as my students like to say, they age you, which they do, because your immune system treats these proteins as foreign, so it attacks them. More immune activation is more inflammation. And the sneaky part is that sugar hides in places that people do not expect. Flavored yogurt, bottled salad dressings. Some of them are really tasty, hard to avoid. Maybe you just need to cut it down a little bit. Granola bars, fruit juice, even pasta sauce. If you start reading labels, you'll see it everywhere. You don't need to be perfect, but reducing sugar even gradually is one of the highest impact dietary changes you could make for rheumatoid arthritis. Number 2 is cooking oils. And this is one that surprises almost every patient I talk to, because a lot of these are marketed as heart healthy. I'm talking about canola oil, soybean oil, corn oil, sunflower oil, and plain vegetable oil. These are almost in every restaurant, in packaged snacks, in store-bought dressing. I'm not going to get into the seed oil battle, because seed oils, I will just say briefly, are not all bad. Because here's the issue. Your body needs 2 types of fat to manage inflammation: omega-3s, which calm it down, and omega-6, which can make it worse. Those oils are extremely high in omega-6s. And in small amounts, like I said, it's fine. But most people eating a Western diet are getting 15 to 20 times more omega-6 than omega-3. And we do need omega-6, we just don't need this huge imbalance, because that can feed into the inflammatory process, which does not help your joints. And then cook everything in all this oil and wonder why they're flaring. One of my patients said to me, I don't understand why I'm feeling so bad. My joints don't feel good. I've gained all this weight. She's like, I only eat out at high-end restaurants. I don't eat at fast food places. These are all high-end places. But when you order those French fries, whether they're in a high-end place or a fast food place, they're still using oils. They're still using refined products, the kind of stuff that you would not use for yourself if you were making it at home. And it's still cooked in fat, in butter, no matter what type of restaurant you go to. So what can you use instead? You can use extra virgin olive oil. I know it's more expensive. It is the best studied option for inflammation. And if you cannot use it, it's okay to use the other oils, just use less of them. For high heat cooking, avocado oil can be great. Both of these have actual anti-inflammatory compounds in them, not just fewer inflammatory ones. Number 3 is salt. This one surprises a lot of people because they think of it as a more neutral thing. It's not really a bad food, but the amount matters a lot. Another large study of thousands of people found that eating more than 3.5 grams of sodium a day significantly increased the risk of RA. And once you have RA, high sodium intake has been shown to increase joint swelling and joint pain. Here's why. Your immune system has a special type of cell whose entire job is to tell your immune system to calm down, like the brakes of your immune system. And when you have high sodium, it suppresses those brakes. So when you're eating a lot of salt, you're cutting that brake line on your own inflammation and kind of letting it go wild. And the problem isn't that pinch of salt that you're adding at home. It's restaurant food, fast food, it's canned soups, deli foods, deli meat, frozen meals, and condiments, where sodium is used as a preservative that most of us don't even realize. Now, some people have switched to potassium salt, which is sometimes called salt substitute, or it's sold as new salt. And the research shows that it can reduce the blood pressure and cardiovascular risk. And for most people with RA, it could be a reasonable swap. However, it's not safe for everybody. For example, if you have kidney disease, if you're on certain blood pressure medications, like ACE inhibitors, or water pills, the diuretics, these tend to retain potassium. And if you're adding salt everywhere with that potassium salt, that can definitely increase your potassium to the point where your heart is affected. I know, because that's the type of phone call we usually get in the middle of the night from the lab saying that the potassium level is very high. Number 4 is red meat. My patient said to me the other day, I've cut out a lot of my meat. I just like my roast beef sandwich every day from this deli down the street, which is really good. Well, that also counts. It's part of the whole processed meat. Whether it's deli meat, hot dogs, sausage, bacon, processed meats are high in sodium, and they have these preservatives that your body treats as pro-inflammatory. But red meat in general also has a very specific type of fat that your body converts into the exact molecules that cause joint swelling and pain. The largest studies on diet and RA found that following a Mediterranean pattern, which limits the red meat to roughly about once or twice a week, and it replaces it mostly with fish, beans, vegetables, olive oil, it significantly reduced disease activity in RA patients. And then there was recently the Plants for Joints study, which also shows that eating a more whole food plant-based diet, which did not have meat, really helped people feel better who had RA. Now that study though also had exercise as a component and a third arm as well. So you can't say it was all diet, but I would say it was more lifestyle measures that really helped patients with RA. I'm not telling you never to eat red meat if that's what you love to do. I'm telling you that frequency matters and amount matters. If you're eating it every day, pull that back to once or twice a week and replace some of it with other substitutes. Preferably plant predominant, but also if you choose to eat fish, you could do more fatty fish like sardines, salmon, mackerel. Those fish specifically contain omega-3s. That can really help with inflammation as well, because omega-3s are one of the few parts that were studied in RA that did seem to help disease activity and people feel better. So you could do it in supplements, but it was a very high amount. It was about almost 3 grams a day. Number 5 is alcohol. And I want to talk about this a little bit differently than you usually hear it. I know that the CDC has now said that it's a carcinogen, contributes to cancer, but let's talk about how it affects RA. First, in general, alcohol can disturb the lining of your gut. And that healthy gut lining is a barrier for you. It controls what gets into your bloodstream. Alcohol loosens that barrier, which lets bacterial fragments leak into the circulation. Your immune system will react to those fragments by ramping up inflammation. That's a direct mechanism for worsening rheumatoid arthritis. Alcohol also disrupts your gut bacteria. We've talked about gut dysbiosis, or just having that imbalance of bacteria, good bacteria versus bad bacteria. Alcohol can disrupt that. And it interferes with sleep. And already RA interferes with sleep. Whether it's the pain, the stiffness that wakes you up in the morning, the active disease that makes you uncomfortable, or the accompanying fibromyalgia, sleep can be an issue with RA. So you don't need something else that's going to contribute to poor sleep, like alcohol. Now the part that's specific to RA, especially if you're on a medication called methotrexate, or sometimes even leflunomide, methotrexate is one of the most commonly prescribed medications for rheumatoid arthritis, then drinking alcohol is a serious concern, because both methotrexate and alcohol are processed by your liver, and combining them will increase your risk of liver damage significantly, even at what feels like a moderate amount of drinking. It doesn't seem like too much, a couple drinks here and there, but if you're on methotrexate as well, that can really promote active issues that could happen to your liver. Many of my patients don't realize this, and it is a conversation you should have with your rheumatologist, because we have other medications. No judgment. I don't want you to feel like you'll be judged if you say to your rheumatologist that you drink alcohol. It is very different if you're having one drink on your birthday versus 2 drinks every night. And if that's the case, we have other medications that you can switch to. Number 6 is gluten. And I want to talk about this because the internet has made this very confusing. Gluten does not cause inflammation in everyone. There, I said it. It can bother some people, but it is not a blanket thing that everybody needs to remove to reduce inflammation. For most people, it's completely neutral. But there is a real subset of RA patients where gluten can make your symptoms worse, and you may not even know it. Here's what happens. When gluten reaches the gut, it triggers the release of a compound that opens up gaps in the gut lining. And if you already have a gut lining that's more permeable than it really should be, which many autoimmune patients do, that's why they have problems with some of these healthy foods, fermented foods, because your gut is really having a lot of issues with imbalance of bacteria, gluten can make this worse. You get these partially digested proteins into the bloodstream, your immune system flags them as foreign and goes after them. And the result is more inflammation lands everywhere, including in your joints. There is a documented association between rheumatoid arthritis and celiac disease. Both are autoimmune, and you may have heard that once you have one autoimmune disease, you are unfortunately more likely to have another. Both are common in people with the same gene variants. So if you or a close family member has celiac disease, that's an additional reason to pay attention here. So every once in a while, a patient will tell me, oh, my brother or my sister got diagnosed with celiac disease, and I like to just throw it in. It's a blood test that you can easily get. But when somebody tells me this, I think it's a good time to check, even if they have no symptoms, because it may be a problem in the future, or they may be having flares that they don't realize are connected to this. So my practical recommendation, if you have RA and you are regularly experiencing bloating, stomach discomfort, digestive discomfort when you eat any food, or GI symptoms along with your joint symptoms, try a strict gluten-free diet. And remember, there's a lot of foods that have gluten in it that you have no idea. But you can try it for about 60 days, up to 90 days, so 2 to 3 months, and track your joints and see if they feel better. Specifically, the morning stiffness, how you feel when you wake up, how long before you feel loose and can move about your day freely. If those improve beyond what you expect with just taking medications, then you might have something here. And remember, it's not just celiac disease. You could be gluten sensitive, but not gluten allergic. So those are 2 different things. Now, to get the real diagnosis of an allergy like celiac, you could see a GI specialist. And also, I want to just put a plug in here that there are definitely people, somebody's been told they had RA for many years, and all of a sudden, the GI symptoms become so prominent, they go to a gastroenterologist and they actually have Crohn's disease or ulcerative colitis. So we recharacterize their disease. We don't call it RA anymore. We call it Crohn's related arthropathy, because those diseases can cause an arthritis. Now, if you try cutting out gluten and nothing changes, gluten may not be your issue. Don't spend the rest of your life avoiding it unnecessarily. Number 7 is ultra-processed food. And I'm saving this for last because it's like the umbrella over which everything else we talked about. Ultra-processed foods are those packaged snacks, fast food, most things that come in a bag or a box with a long ingredient list. They're high in the refined oils that we talked about. They're high in sugar. Sometimes when they're not even sweet, they're high in sugar. They're high in sodium. And they're full of additives like emulsifiers. So sometimes you may not have an allergy or sensitivity to a specific food, but if it's packaged in this way with certain preservatives, that may be what's bothering you. Emulsifiers are really what gives the ultra-processed food the smooth texture. So people like to put it in. Manufacturers want to put it in there. They want you to eat it. They want you to buy it, spend money for it, so they make money. They're in things like mayonnaise, salad dressing, ice cream, and most packaged baked goods. I bought this ice cream machine recently, and I realized you really have to have the gums or the emulsifiers in there to get this smooth, creamy texture. It tastes fine also without them. They still taste good, but to get that texture, which is what people want you to buy, right, when you're paying money for it, they like to put these additives in there. Research has shown, though, that emulsifiers can destroy that protective mucus layer lining your gut. And when that layer breaks down, you're back to the same problem we've talked about throughout this video. More immune activation, more inflammation. The simplest way I explain this to my patients is that the more that your food looks like it came from a factory instead of a farm or a kitchen, the more likely it is to be driving inflammation in the background. And that doesn't mean I don't ever eat anything packaged or that my kids don't, because certainly they want to. It means it's worth looking at what percentage of your daily food falls in this category. For most of my patients, just shifting that ratio towards whole foods, even modestly, like even a little bit, makes a difference that they can really feel. So those are the 7: sugar, refined cooking oils, excess salt, red and processed meat, alcohol, gluten for those that are sensitive, and ultra-processed foods. And we're noticing this in the ultra-processed foods, even in countries that were previously making their own food, more natural, because people don't have time anymore. They're always working and they need something quick on the go. But there are different versions of this. Look for a single ingredient or a couple ingredients instead of the whole list. Here's my advice though, don't try to change all 7 of these at once. Pick 1 or 2 that you think you could work with first and that you know you eat the most of, and focus there for 60 days, for 2 months. Track your symptoms, which I think everybody should do when they have RA. Track the morning stiffness, the energy level, your pain level when you get up. Just take your phone out. You have the notes section. All the phones have them nowadays. Keep a simple log on your phone. Food is not a replacement for RA medication. I want to say that again because it does matter. Your medication is doing something that food cannot do. It's actively protecting your joints from damage that you cannot feel is happening because it can be so subtle. That's why we get x-rays every once in a while when we're suspicious. And once it's done, you can't reverse it. But food is that active variable that you can control. It does influence inflammation. Do I have some patients with RA who are barely on any treatment at all, but are very active with lifestyle measures? I absolutely do. And they know what bothers them and how to kind of rein it in. But I also have those that need help with medications as well. And I would say that's the majority. So see where you fall on that, but there's always ways to optimize and improve. You have control over this one. Drop a question in the comments if you have them. I'm Dr. Neha with Plant Forward MD. I'll see you next time.